Medical professionals of Reddit. When was someone's self-diagnosis surprisingly accurate? Patient not doc. But I was almost as amazed as my PCP when I was right, so I'll share. My dad had been diagnosed with AFib and an arrhythmia a year prior. He was told that most people are not diagnosed until they have a problem. My dad took me and my kids to the science center where they had an exhibit all about the human body. There is a section all about the heart. They had several things that would monitor your heart rate, including a drum that would beat along with your heart when you touched sensors. Everyone else had nice steady heartbeats show up on all of the little things that they had. But mine kept acting funny and so did my dad's. The thing was, I didn't have any symptoms and I felt perfectly normal, so I didn't think that it would actually mean anything. It's basically a toy, right? I told myself I'd feel dumb if I didn't mention it to my doctor in case there was a link. When I suggested that I thought I had arrhythmia because the science center gadget didn't pick up my heart rate the same as everybody else, my doctor looked at me a little funny, but ran the tests. Sure enough, they found it and did a few more tests to establish a baseline for comparison later on in life. AFib is scary cause you can have it for years and not even know. Apple is actually using the built-in heart monitor on the Apple Watches to run a crap ton of medical studies on situations like AFib, to both help catch it early and monitor it. IDK if you have an iPhone, but if you do, look into it. My stepfather is a doctor and told me two stories. One was an older Irish woman who correctly predicted that she had a tumor in her left lung roughly the size of a golf ball. She has never smoked or done anything that made her a risk, but she insisted her very mild cough was the result of a large tumor and demanded to have it checked out. She was dead on and claimed she saw a person on TV with the same symptoms, and when she fell asleep her dead husband in her dream told her to go to the doctor and her she was. The second was a guy who said he felt like he was stabbed and thought something went wrong with his surgery when they removed a cyst from his lung. He was half right. The surgery went fine, but he had a thin strip of metal shish kebabbing him through the chest because he apparently plopped onto his bed without removing some junk, including a large 6-inch receipt spike. His bandages covered up the new wound. In other words, it felt like he was stabbed because he was stabbed. Bonus. An old lady told a room full of very alarmed doctors who thought she was ridden with very dense, possibly calcified tumors that they didn't need to worry. Also, those dots are probably from the time a crazy guy shot her with a shotgun when she was 15. But it's okay now because she forgives him, as it's God's job to judge, you know. They had two of the pellets removed as one was sitting on her heart and another was pressing into a blood vein, but easy to get to, and left the other 25 in. Weirdest thing my stepfather says is that she made it to 80 years old without ever getting an x-ray of anything but her foot, so there wasn't a single word of it mentioned anywhere. He apparently plopped onto his bed without removing some junk, including a large 6-inch receipt spike. Why? Why would you put that on your bed? I'm a Navy corpsman, so I've heard my fair share of interesting stories and self-diagnoses from Marines. This one is probably the only one that has ever truly caught me completely off guard though. A young lady comes in and asks me in a low voice if she could talk to me in private before she made her appointment. Usually, that meant one of two things: an STD check or some sort of feminine concern, genitourinary symptoms, wanting contraception, pregnancy. So I took her to a quiet, semi-isolated area and asked her what's wrong. I have worms coming out of my anus, and I think I got it from my cat. My initial response was, okay, what makes you think that? She describes the worms and why she thought that. For the record, her symptoms were an itching in the anus, worse at night, and she had felt little wriggly things when defecating. Her cat had been diagnosed with worms and slept with them in the bed, and her husband was also showing symptoms. I take the history as best I can, go to my provider, explain it to her. She is just as confused as I am, but says, well, if she says it's worms, let's get a fecal sample. And lo, she returned 2 days later with a fecal sample that tested positive. I have a couple other stories I'm happy to share, but this one was the most off the wall one. When I saw got it from my cat, I was worried where that story was going. I correctly self-diagnosed a blood clot in my leg. I went to the ER with excruciating pain in my calf and told the doctor that I suspected a blood clot. The doctor assured me that I was young and healthy and I wasn't at risk for a blood clot. He diagnosed it as a pulled muscle, offered me some painkillers and sent me home. Fast forward 2 or 3 weeks. I still had excruciating pain in my calf. and I started to develop severe shortness of breath. I went to the urgent care clinic this time. The doctor at the urgent care clinic immediately suspected a blood clot and sent me to the ER for some tests. The ER doctor did an ultrasound on my leg, declared that I didn't have a blood clot, and sent me home. The next morning, someone from the ER called me and sheepishly admitted that they had misread the test the night before, and I did in fact have a blood clot. It turned out that I had had a blood clot in my leg all along, and the clot had broken off and traveled to my lungs. Thankfully, I've made a full recovery, despite nearly being killed by the incompetence of multiple doctors. 2 years ago I started having a short, sharp pain in my head like I had swallowed ice cream. Brain freeze. Every morning when I stood up out of bed and when I stood up after my first morning pee. I didn't think much of it. It was like this for a month and then started to become more frequent whenever I stood up. The head pain gradually started coming out of nowhere, like when I laughed or sneezed, and lasting longer and longer. Then one day it came out of nowhere so intense like a freight train in my head I was screaming in agony. It was unreal and I thought I would die, way beyond a migraine. That's when I figured out that literally as soon as I hung my head down the pain would completely go away, until I lifted my head back up. If I waited with my head down long enough, around an hour, the pain would be gone for a good while. So from then on I started just going upside down or laying down with my head over the couch whenever I felt the pain. I also then figured out that taking massive amounts of caffeine made the pain go away. The pain was still unreal every time, but I had a super easy way of making it go away. Unfortunately it started to interfere with my work, obviously because I have a desk job, software developer, and I had to take long breaks and hang my head. I actually started a new job at this time, and on literally my first day I was hit with the pain and my new boss grabbed a trash can for me to throw up in. It really became clear I had to do something. So I googled head pain when upright or something like that. Found out about intracranial hypertension, and from there, Chiari malformation. I figured out that hanging my head made my brain go back up and give CSF some more room to flow in and cushion my brain. That's why it helped. My husband drove me to the ER. I said, I think I have Chiari, please do an MRI. They did and saw Chiari and severe intracranial hypertension. Got sent to a neurosurgeon and 2 weeks later I had brain decompression surgery. From what I read, Chiari usually takes 5 years to be diagnosed. It took 1.5 years of recovery before the pain mostly went away, but it's all good now. I'm a nurse, but these are me as the patient's stories. When I was in high school, I started feeling very run down. It started with a cold, then a bad sore throat. I started sleeping a lot more and didn't eat as much. At that time I was a walking garbage disposal. My dad took me to urgent care. They did the typical strep test, which was negative. My dad asked if it could be mono. The doctor laughed it off, said it was an upper respiratory virus. Take some Tylenol for pain and I can continue my normal routine. Week later, we're back at urgent care as my condition only got worse. I lost 10 pounds and was ridiculously pale for mid-August. My dad demanded a mono test, and guess what? That's what I had. The doctor then changed his tune to, I need a lot of sleep and fluids. Frick you, Dr. Hermaine. Next, my first year as a nurse. I started feeling off. I would forget mid-sentence what I was talking about and entire conversations. I started getting too tired. I was sleeping 16 hours and that didn't feel like enough. I was always freezing cold, aside from the normal Ohio April, and at random intervals. My arms would either get numb or get pins and needle feelings. Got myself a primary care physician. Went to my appointment. I told the woman I'm pretty sure I'm anemic. She argued. Ordered a pregnancy test. Negative. Tried prescribing me antidepressants, saying that was the issue. I got pee and demanded blood work to be done. My lab work comes back. Another round of mono and anemia. The doctor who called to tell me my results apologized profusely and we had a good laugh about maybe that's why I am so tired. TLDR. Frick Lake Health. I'm sorry to everyone else who had to go through this. It's terrible how doctors are so quickly to write people off, even though there's something obviously wrong. Mono or anemia. You can feel there's something chemically wrong in your body. The depression or pregnancy part of my ordeal with that doctor completely pee me off. And the more annoying part is the pregnancy test was a urine test. She wasn't even planning on a blood test until I demanded it. My landlady fell and broke her arm. She had diplopia, double vision. One morning I was going out to work, and she was going to the hospital for an outpatient's appointment for the diplopia. I saw her face that morning and noticed a drooping eyelid. Ptosis. On the bus to work I remembered a picture from an old medical textbook of a lady with myasthenia gravis and a ptosis. I was a medical student 25 years ago. The alarm bells rang. There was the broken arm, which happened when she was coming back from the shops with heavy bags. The double vision and ptosis were also signs. Over the last few months she had been generally getting tired quickly, had low energy and had lost her sparkle. Sometimes we thought she was drunk because of slurring. I called her and told her to tell the doctor to check for MG when she was in clinic. They didn't take her seriously. I told her son later that day. He's a psychiatrist. He also thought it was likely and did some quick clinical tests which were positive. Patients with MG will rapidly tire, so repetitive movements will start strong and quickly become very weak. He phoned the GP who got her a rapid appointment with a neurologist. MG was diagnosed by a blood test. TLDR. Failed medical student diagnoses rare condition from a hazy memory of a picture in a textbook. Obviously not a failed medical student if you were able to help at least one person. I am a nurse now, so this pisses me off even more. When I was 19 I developed marble-sized tender areas scattered on my legs. I called for an APT, and the receptionist didn't know what to out for a reason for APT, I guess. So she said she would put me for a regular checkup, and I could talk to the doctor then. When I got there the assistant prepped me for a checkup, had me undress for a pap smear. Doctor came in and before I could speak she seriously told me off. She said I didn't need a checkup. I had a pap 7 months ago. She said I was wasting her time and people like me was what was wrong with the healthcare system. She barely looked at my lumps, said they were lipomas, as if I knew what that was. It was nothing. Told me to get dressed and she left. The lumps grew a little. I got a couple more and they were more tender, to the point I couldn't wear certain socks or clothes that touched them. I wasn't living at home but my mom happened to notice one day when I was visiting, and made me go to another doctor a couple months later. Turns out it was strep. I had a sore throat at some point then it went away, so I thought. Took some antibiotics, changed my primary, and went on with my life. A few years later, I am an RN and I have a patient that is very young like 27, and on dialysis. He tells me his kidneys failed because evidently he had strep throat. Didn't know, and then it traveled to painful small lumps on his legs. He didn't have insurance so he didn't get it checked out, and a year or two later the strep had destroyed his kidneys. I guess this is not a self-diagnosis story. However, if only one person that knows something is wrong reads this and gets the courage to seek a second opinion I will be happy. And frick you Victoria near MD in Albuquerque, NM. You were having a bad day and almost fucking killed my kidneys 30 years ago. I started getting all of the signs and symptoms of a UTI, but without any bacteria in my urine. This happened 3 times about 1 month apart. I was in horrific pain for several days each time and I had to pee constantly. One day I peed before getting in the shower, while I was in the shower, and then as soon as I got out, I even ended up peeing my pants one day at work because I couldn't get to the bathroom fast enough. There was also large amounts of blood in my urine. I'm a postpartum nurse, so when I say large amounts, I mean it. I was referred to a urologist, who sent me for a CT. I had told him I thought it might be interstitial cystitis from my googling and he simply told me I was too young, 23 years. The CT came back normal and the next time I saw him, I was asymptomatic, so he assumed I was cured and told me there was nothing else we could do. Keep in mind I had this pattern of only being symptomatic 1 week per month. I went and got a second opinion because frick that guy. They took me seriously and flat out told me that the first guy mishandled my case. They said anyone with repetitive visible blood in the urine should get a cystoscopy, especially if they're only 23 years old. Turns out I was right. TLDR. Was peeing blood and in terrible pain. Peed my pants at work. Urologist told me I was too young to have the condition that a urogynecologist ended up diagnosing me with. Obligatory not a medical professional. This is actually 2 parts. I had a lump behind my left earlobe that grew for probably 3 years. and no one believed me until it was the size of a grape, 1996 to 1999. Once my parents and pediatrician could see it, I could feel it all along. I had it removed twice, 1999 and 2003, and after the second surgery developed a recurring infection that resulted in a recurring abscess, both gross and painful. Basically a huge zit you have to pop and drain. Had a third surgery, 2005, to fix this. They said there was a capillary connecting my esophagus in this area behind my ear, but it kept coming back despite being on Keflex perpetually. My plastic surgeon ran out of options, and when asked said, well, I guess we could consider radiation, as if that's a real answer. IDKY, no one suggested a different doctor or antibiotic, but whatever. I noticed that it always started up before I got sick, like a cold, and went to see an ENT, 2009, who told me it was basically a sinus, and I should have a fourth surgery for marsupialization where they basically sew it open so it can't fill up anymore. It also results in a not so insignificant scar. No, thanks. Got an upper respiratory infection, 2010, was prescribed a ZPAK for the first time ever, completely cleared up the infection behind my ear. Went back for another round 10 days later when I was still coughing my brains out and saved it for the next time my ear started to get inflamed. Took it, and haven't had the infection or an abscess since, almost 8 years later. Not a medical professional, but me. A couple years ago during the summer I started feeling really off out of nowhere. I had zero energy and ended up getting a really bad fever. Within a few days I developed a pretty bad cough. I went to urgent care because I didn't have a doctor at the time, and they essentially pat me on the head and told me to get some rest. They told me I just had a cold or at the worst the flu and sent me home. Getting some rest didn't help. I was calling out of work every day and spending all of my time sleeping. When I wasn't sleeping, I was up sweating and coughing. I went to the hospital because I was young and dumb and still didn't have a doctor. They tested me for Lyme disease and sent me home. After a week of going through this and still not getting any better, I honestly didn't know what to do. I had stayed home another day, and when I had gone up the staircase in my house, I had to sit down at the top because I couldn't breathe after and felt like I was going to pass out. I texted my mom and my boyfriend and told them I thought I had pneumonia after googling about it for a little while. They both disagreed. I was 22 and my mom swore people my age didn't get pneumonia. I decided I couldn't take it anymore and drove myself back to the hospital. Crap, sure enough, they took my temperature, 102 degrees. They took x-rays and shockingly enough, I had a pretty serious infection in my right lung. I ended up staying in the hospital for 6 days with antibiotics through an IV. I was that guy. Woke up at 4:31 morning with a pain in my lower abdomen. Threw up, walked around the house for a few minutes and told my girlfriend I was headed to go to the hospital and get my appendix taken out. She said she wouldn't let me drive myself, so we headed over together. Walked into the ER and told the triage nurses docs what I thought was up. They rolled their eyes and put me on the list. 20 minutes later I'm in for diagnostics. Doc tells me I'm not making a great case for my appendix because people usually experience a lot more pain than I was letting on, but that we'd wait for the blood work to come back. Blood work comes back. White cell count is elevated, so they schedule me for a few more scans. At this time I call in sick to work. Tell them to make plans for me to be off for a few weeks. Go do scans. Doc says my appendix should come out. Look at girlfriend. Told ya. Got cut at 6 PM, walked out the hospital's front door at 7:30 the next morning and waited for GF to pick me up by the door. I'm not a medical professional and I'm late to the game. But, when I was a truck driver, I was driving not too far from Lewiston, Idaho one winter. When I came over a rise and there was a very fresh, very gnarly 4-car wreck sprawling across both lanes. I immediately stopped, popped on the flashers, called it in, and then got out to see if anyone was alive. There was zero movement. Got up to the first car, and in the driver's seat was a young guy, maybe 18 or 20. It was an older car, and didn't have an airbag. He was completely impaled on the steering wheel. He had coughed up some pink foam, and I thought he was dead. I stood there, having no idea what to do, when his eyes opened, and he looked at me and said, "Tell them to send a helicopter, not an ambulance. I'm going to die now." And then he died. About 5 years later, in Bruges came out, and the scene where Brendan Gleeson jumps off the tower hit me so hard I had to go see a therapist for PTSD I didn't even realize I had. I still have nightmares about it. Obligatory, not a medical professional. A mate of mine punched the car window during a fight. Don't ask, I still don't know. Later he came up to me and was describing his super smart act and replayed the punch. His hand was very obviously broken. He'd completely snapped the fifth metacarpal, the bone in the hand that attaches to the little finger, and it was bowed in the middle really badly. I got him into a taxi and we headed to the where the doctor ummed and ahed for a minute, took an x-ray, and discharged him with some OTC pain meds saying he'd simply sprained it. By this time it was about 4 AM and I was grumpy, so I told the doctor to check again because if he thought that it was a sprain he should hand over his stethoscope and medical degree to me, as he was obviously a moron. Security was called, we left. 2 days later my mate gets a call from the nurse telling him to go back in to have his hand cast because he's broken it. I have a great deal of respect for medical professionals, except that guy. He shouldn't have been there. I was undiagnosed for 13 years, unable to keep health insurance or an income because of the severity of my symptom. Anytime I did find a way to go to a doctor, they just dismissed me as either having somatization disorder, depression, or making poor lifestyle choices. So I started doing research on my own. First, I found out about fibromyalgia and thought I'd found the answer. But the more I read about it, the less I could relate to it. Then, I found out about myelodysplastic syndrome and thought I'd found the answer. But the more I read about it, the less I could relate to it. Then I started researching again one night and found out about Ehlers-Danlos syndrome. I dismissed the idea at first because skepticism is ideal sometimes. Then I found out that there were different types. The more I read about the vascular type, the more I found myself relating to it. Slowly, ever so cautiously, I dared to theorize that this might be my disease. As time passed, the theory grew stronger. The more I learned, the more I could relate. But with no health insurance and no income, it was almost impossible to pursue a diagnosis. Many years later, I got a GoFundMe donation, and I was able to see a geneticist. She diagnosed me with hypermobile Ehlers-Danlos syndrome. So I was mostly right. I dream of the day when I can shove my diagnosis in people's faces. I'm not trying to demonize medical professionals here. Not all doctors are bad, and most of them aren't. But to finally be validated is a feeling like no other. Not a medical professional, but self-diagnosed. So to preface, I was born with a lot of medical issues and abnormalities, missing most of my small intestine, polysplenia, midline liver, pancreas in the wrong place, a piece of liver tissue next to my spleen, and extra intestinal tissue not attached to anything, just in my abdomen. I had also been diagnosed with asthma at a young age and used an inhaler and did breathing treatments for years, despite never having any asthma attacks. And when I was very young I got pneumonia quite often, always in the left lung. Around 8 or 9 I started having a ton of back pain. I had x-rays, bone density scans, ultrasounds on my kidneys, all kinds of crap to figure out what was wrong. Couldn't figure it out, was told on numerous occasions I was just constipated and that was what was causing my back pain. I used to say, but it hurts, right here, and point to a spot on my mid-back, just next to my spine, like something's, and there was told over and over I was fine, put into physical therapy, etc. I was having to use my inhaler more often as well. Finally I go into the doctor again because the pain is just not going away. I get a CT scan, and lo and behold there is a 5cm cyst nestled between my left lung and diaphragm, pressing up against my spine. So I have surgery to remove it. Recovery was heck because the first cut the surgeon made went straight into my lung because of my weird anatomy, not surgeon incompetence, and I had to have a chest tube for 3 days. But when I started really recovering I realized I had zero asthma symptoms anymore. I haven't used an inhaler in years and don't have respiratory issues like I used to. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.